Hello everyone, this is Dr. Veena and you're watching my YouTube channel, Dr. Veena, your homeopath. Well, today's topic which we are going to discuss is about urinary tract infection. Friends, urinary tract infection is a very common condition which we see in our day-to-day OPDs. Let's talk about urinary tract first. Urinary tract comprises of the parts kidney, then ureter, then urinary bladder, and ultimately urethra. Now, the symptom of urinary tract infection depends on which part of urinary tract is affected. Like say, if infection is around urethral area, then it is called urethritis. The symptoms will be burning of urine, there will be high frequency of urination, urging of urination will be again more, and the patient or the person suffering from urinary tract infection will say there is blood in urine, the color of the urine is become very dark, smelly or cloudy urine. Similarly, if the infection is around bladder, there will be pressure and pain around the pelvic area, the lower abdomen area, and other symptoms of urethral infection. And if the infection is towards kidney, it is called pyelonephritis. It can be acute pyelonephritis, it can be chronic pyelonephritis, and the person suffering from that will say, I have a pain towards my backside or towards the flank area, as kidneys are retroperitoneal organ. Now, if one kidney is affected, then the pain will be on that side, on that particular side also. If it is an acute condition, there will be nausea, vomiting, and fever. And if it is chronic, pain will be there, which is chronically there will be pain and other symptoms of other urinary tract infection like micturition problem, the burning sensation, and likewise. Now, after knowing the parts and the symptoms of urinary tract, now let us talk about who all are at risk. My dear friends, being female is give you a higher chance of urinary tract infection. How? Anatomically, the urethra of female is around 4 centimeter, which is very short compared to the male counterpart, which is around 20 centimeter. Now, because of this, obviously, the chances of infection will be higher in female. Similarly, during menopausal area, when menopausal time, when the hormonal imbalances are there, estrogen level are very less, that time also urine infection is high. Second thing, the behavior. Certain behaviors like if somebody who is not drinking water enough, someone who is not drinking fluids enough, they have more risk towards urinary tract infection. Similarly, if these people, they do not void urine at regular intervals, again, chances of urinary tract infection is too much. Using certain feminine products like perfumes or talcum powder or things like that also causes irritation towards the genital area, including urethra, and thus infection are more in them. Using certain spermicidal agents also causes urinary tract infection. Similarly, sexual activity and hygiene is very important. Sexual transmitted diseases are associated with urinary tract infection. Next, friends, certain structural conditions, structurally if proper development is not there, or even urinary, the kidneys having, stones, these conditions or other medical conditions like diabetic or immunosuppressor conditions, in these all urinary tract infection risk is higher. Now friends, after knowing who all are at risk, Now, let us find what is the cause of urinary tract infection. In most of the cases, bacteria, E. coli, is the cause of urinary tract infection. Apart from that, certain sexual transmitted diseases are associated as well as causes urinary tract infection, chlamydial, gonorrheal, etc. Now, what are the lab investigation to be done to find urinary tract infection? Clinically itself, it is when the person says that it is burning and everything, it really directs or towards urinary tract infection. Apart from that, urine analysis has to be done, urine culture has to be done, uh, urinary tract scanning has to be done, USG has to be done. Now, friends, let's talk about preventive measures. Well, urinary tract infection is a foremost a play game of bacteria, colonization, multiplication. So our first aim is to flush out these bacteria outwards the urinary tract system. So for that, drink plenty of water and fluids. When you drink water as well as you avoid urine, then definitely along with that, the bacteria, the infection also flush out from our system. Secondly, it has been seen that cranberry juice are really very effective in infection, urinary infection, as well as other kidney conditions. Thirdly, hygiene. Well, wiping from forward to backwards, as well as avoiding certain products, feminine products, like as I told, certain tall compact powders, certain perfumeries, etc. This has to be stopped and avoided if it is irritant to those areas. Now, saying this, let us talk about homeopathic treatment. Friends, homeopathy is really very good in urinary tract infection. There are so many medicines. Well, because of the time constraint, I will be dealing with one very important medicine called Cantharis Vesicatoria. Well, other medicine like benzoic acid, lycopodium, sarsaparilla, then petroselenium, Barbaris vulgaris. These all are Apis mellifica. These all includes in these medicines are really very helpful in urinary tract infection. But today our topic will be constrained to Cantharis vesicatoria. Cantharis is a medicine which is prepared from animal kingdom, and it is the common name of Cantharis is Spanish fly. Now, in this medicine, the red strand symptom is burning of burning of urination. The burning pain is there, and secondly, intolerable urging. The urging is just intolerable. Now, these are basic common symptom of urinary tract infection, but if the intensity of these two symptoms are very high, are 3 plus, yes, the medicine is Cantharis. You feel burning is too much, which is just intolerable, the pain is too much, and the urging is also too much, it is very intensified, then Cantharis is the medicine. Now, one more medicine which has to be differentiated is petroselinum. Well, in Cantharis, there will be constant urging. The urge will be there during micturition, before micturition, during micturition, and after micturition. But in petroselinum, the urge will be sudden. It will be like the person will be, he or she is all calm and quiet, but suddenly the urge of, the urge of going and voiding urine will be sudden. But in Cantharis, it is constant you feel. Even after micturition also, you are not feeling better. Medicine is Cantharis. Now, other symptoms like if you have burning, ineffectual urging, which I said, then there is, blood is there, the urine which is passed is in drops, or a very intensified colored, or in all these symptoms, Cantharis vesicatoria works really well. in general symptoms, if the person, if we ask, do you like drinking water, or do you like how much you drink, and the person says, I actually doesn't drink much, in these cases, there is actually disgust, in the very important symptom, disgust for water as well as other fluids. It is very common in Cantharis. The medicine will be Cantharis Vesicatoria. Drinking water, it will cause pain in the bladder. Again, Cantharis vesicatoria. So these general feature, along with urinary system symptoms, urinary tract symptoms, it includes, and you give Cantharis, this medicine will definitely help in these patients. Now, let us talk about the potency. It has been seen that Cantharis, if given in higher potencies, I'm talking about 30 ch, 200, 1 m, and even more, it is really very good. So, give medicine, try to give medicine in higher potencies, 30 ch, 200 ch, 1 m, and more, and definitely it will help the people suffering from urinary tract infection, along with the preventive measures. And preventive measure, as I said, drink lot of water, fluids, avoid all the irritant parts. Then definitely urinary tract infection, the trouble, the recurrency of urinary tract, the person, people do suffer from urinary tract infection recurrently, and taking all these other medicines, it doesn't help. There, homeopathy is the solution. Well, concluding by this, let me say, if you liked my video, you think it is really helpful, please like and subscribe and hit that bell icon. It definitely encourages me to make more videos like this. So till then, goodbye and thank you.